Hello, I'm Melody King. I'm the compliance manager here at Four Seasons Compassion for Life. In the next few slides, I'm going to show you what you'll need to know about our upcoming Joint Commission survey, what we're doing to get ready, and what role you can play when inspectors are on site. The on-site survey is a terrific opportunity for us to demonstrate our values. Although some people feel nervous about speaking with an inspector, let's remember that we all want the same thing: excellent care for the patients, clients, and families that we serve. This is our opportunity to show them the amazing work that we do every day.
The Joint Commission, also known as TJC, has a big job. It evaluates over 20,000 healthcare organizations, sets standards of care, and accredits organizations who meet these standards. The great majority of these standards, by the way, relate to patient safety. They want to know what we're doing to protect patients and clients from infection, further injury, and the steps we take to protect their privacy. They're also interested in how we protect ourselves from injuries and infections. Here's their mission statement: to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Sounds good, right? We want that too. So let's look at how we demonstrate safe and effective care and promote best practice when inspectors are on site. We get ready for a TJC inspection by preparing information for surveyors to review. This is the work that goes on behind the scenes all the time. To learn more about what we do, surveyors will review client records to see whether the standards are being followed, employee records to ensure that staff have the vaccinations, training, and licensure that are needed to do the job, and they'll be looking at the facility or environment of care to ensure that it's a safe place to work and care for people. Before inspectors ever arrive in your area, they've already reviewed the types of services we provide, the results of previous surveys, our patient-family satisfaction scores, and our adherence to core measures based on the policies we have in place. Once they're on site, they want to see that our practices actually match the policies. Policy is great, but they want to see that we can walk the walk as well. When inspectors arrive at a facility, you may hear an announcement saying that we are welcoming Joint Commission surveyors on site. Take this opportunity to do a visual sweep of your work area. Remember, we protect those that we serve by ensuring their safety and privacy. Is there any patient information that's accessible to visitors? Are there any infection prevention concerns? The policies are already in place. We know how to wash our hands and we know how to avoid talking about patients in public areas. Inspectors are watching to see whether we're following these policies. If an inspector asks you a question, be concise. There's no need to volunteer additional information, so just answer the question being asked. Whether or not we have surveyors on site, our policies are in place to ensure that we're always ready to provide high-quality, safe care. If you have any questions about the policies or about how your team will function if inspectors are in your area, get with your team leader now to go over this information, or call me, the compliance manager, with any concerns. There's also an anonymous hotline that you can call anytime. This is answered by a separate organization and arrives to me in a written document, so it's truly anonymous. And if you're feeling a little rusty on the policies, now is the time to go ahead and go over this information with your coworkers and team members. A surveyor may ask you questions about the care you provide. Here are a few key points to remember. We protect our patients from infection by washing our hands or using hand sanitizer before providing care. And we protect their privacy by keeping records private. Any documents with patient information are kept secure and are also protected when we're traveling. We also don't speak about our patients in public places or even in the home when visitors are present unless we have explicit permission from the patient to speak freely. We're not permitted to text any patient information. To communicate with other team members about patient care, we send secure messages through the medical record or make a phone call. And we keep good records. We know that accurate, complete documentation is very important. When you're in the home, be sure to review the care plan and to record any new information appropriately. Handoffs are a high-risk area, and surveyors will want to see how we handle our patient handoffs. So complete documentation is obviously very important. Whether in a home, a nursing facility, or on-site at the Elizabeth House, documentation should be completed immediately. Let's say that a surveyor asks you a question that you don't know how to answer. She says, "How would you handle this particular situation?" It's totally appropriate to say, "I haven't had that particular situation come up in a while. So in that situation, I would call my supervisor for guidance." Or if the surveyor asks, what is this organization's policy for X, Y, and Z, and you don't know the answer, you can say, I know right where to get that information. Our policies are available online, and I can access them from Google Docs anytime, with or without an internet connection, or I can call my supervisor for guidance. And now the surveyor knows that in a real-world situation, the policy would be followed. By the way, if you haven't logged on to Google Docs in a while, please check to make sure that you can still get in. It might be a good idea to make sure that you have the IT help desk number in your contacts on your phone. If it's not already there, enter this number into your phone so you've got it handy. I feel very proud to be associated with this organization, and I know you do too. We do great work. When we have surveyors with us, just remember that they want the same thing we do, excellent care. They have busy schedules just like we do. They've probably been on the road. Give them a cup of coffee and a smile, and be ready to show them that we are fully engaged in the excellent care that we provide. Please ask your supervisor if you have any questions. I want to take the opportunity to say thank you for the work that you do every day. And please feel free to give your administrative office staff members a hug because they are diligently preparing documentation to represent your good work when the Joint Commission arrives. Again, thank you, and feel free to contact me for more information.